Hi, I am Peter Glowicki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery. Thank you for viewing this video on the highlights of the best papers we published in the November issue of the Journal of Vascular Surgery. This month, the Editor's Choice article is also your CME article. It is entitled Risk Factor Profile and Anatomic Features of Previously Asymptomatic Patients Presenting with Carotid-Related Stroke. The paper was written by Dr. Derek Clarin and colleagues from Boston and Brighton, Massachusetts and New York, New York. This was a retrospective study of 3,382 stroke patients who were previously asymptomatic. 7% of them, 219 patients, were found to have a greater than 50% ipsilateral carotid artery stenosis or internal carotid artery occlusion. Specifically, 43% of the carotid arteries had occlusion, 46.5% had greater than 70% stenosis, and 9.5% had 50 to 70% stenosis. Surprisingly, only 50% of the patients were on antiplatelet treatment. 55% were taking statins, and 35% were taking both medications. Those who were on both antiplatelet and lipid therapy had less severe strokes than those who had any other treatment. So the authors concluded that asymptomatic patients with carotid artery disease who receive medical treatment that includes antiplatelet and lipid therapies have less severe carotid-related stroke. But the more important message of this paper was that even patients on best medical therapy are at risk of having carotid-related stroke. So this study brings additional evidence that a group of asymptomatic patients need more than just best medical therapy to treat their significant carotid artery disease. The next paper I would like to present to you is entitled Predictors of Early Mortality and Readmissions Among Dialysis Patients Undergoing Lower Extremity Amputation. This was written by Dr. LaTonya Hickson and colleagues from Mayo Clinic Rochester and Jacksonville, from the University of Washington in Seattle, and from Emory University in Atlanta, Georgia. In this NASQIP study, 6,468 patients underwent a major amputation. 18% of them, 1,166 patients, were on dialysis. 30-day mortality was 15% in dialysis patients, and it was 7% in those who were not on dialysis, and this difference was significant in every age group. Similarly, readmission rate was significantly higher in dialysis patients than in patients not on dialysis. So the authors recommend focused quality improvement efforts to decrease this high mortality and readmission rate in patients who are on dialysis and undergo major amputation. The next paper I would like to bring to your attention is on the impact of psychiatry comorbidities on patient-reported surgical outcomes in adults treated for the median arcuate ligament syndrome. This was written by Dr. Christopher Scally and colleagues from the University of Chicago and the Northwestern University Feinberg School of Medicine in Chicago, Illinois. This is a prospective observational trial of 51 adults with median arcuate ligament syndrome. 80% of the patients were female with a mean age of 30.5 plus minus 12.4 years. Short-term results of laparoscopic release of the median arcuate ligament were very good. At 6 months, celiac artery hemodynamics improved, and there was significant improvement in postoperative quality of life as well. It was interesting to learn that 28% of the patients had preoperative diagnosis of a psychiatric disorder that was a significant predictor of decreased postoperative quality of life. This study concluded that MALS patients do well early on with laparoscopic surgery, and the authors also emphasized that preoperative adults with MALS should be assessed for psychiatric disorders to better predict outcomes after surgical treatment. The final paper we would like to introduce to you is entitled Causes and Outcomes of Finger Ischemia in Hospitalized Patients in the Intensive Care Unit. This paper was authored by Dr. Gregory Landry and colleagues from the Oregon Health and Science University in Portland, Oregon. Among 98 patients treated in the ICU for finger ischemia, 82% were on vasoactive medications, 37% had an arterial line, and other risk factors contributing to finger ischemia included mechanical ventilation, diabetes, peripheral artery disease, dialysis, cancer, and sepsis. 5% of the patients required finger amputation, and survival in patients with finger ischemia was poor. It was 84% at 30 days, 69% at 1, and 59% at 3 years. And cancer was a predictor of mortality. The authors concluded that ICU patients with finger ischemia have a relatively low rate of finger amputation, but mortality in this group of patients is increased, particularly if they have cancer. These were 4 of the many excellent papers from the November issue of the JVS. You can download them free of charge at www.jvssearch.org. Enjoy reading all JVS journals and let us know how we can improve them more. Thank you for watching, and see you next time for the highlights of the December issue of the Journal of Vascular Surgery.